COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we're moving into our COVID-19 update for today, brought to you by Fulltech Systems Limited, as we talk about the current situation of COVID-19 in the country. We're joined by Honorable Michelle Shabat, who is the Minister of Health and Wellness. Good morning. Good morning. Can you hear us? I think he froze just that moment.
Morning, my morning. A special morning to its entire Earth.
Yes.
Are we frozen? Are we back?
You are back, and we can hear you clearly.
Yes.
So,
good morning to you. Good morning, Belize, and especially to the fine folks in Kayonar. A very good morning to you all.
All right. So, Minister Shabat, let's just dive into the current situation that we're facing at this time. We've officially moved over the 100 mark with active cases. Give us the status update as to the situation.
Right. Well, currently we have 120 active cases, Marlene. Yesterday we had 38 new cases reported, with the majority of them coming out of the Stann Creek district. Right now we have one person in our ICU, and we have 4 other persons hospitalized. So I think what we've seen over the past week is a spike in numbers, and what is especially concerning for us, Marlene, is that we're seeing this among students and teachers. And this is of great concern for us. As you know, last week in Belize City, some of the schools were temporarily closed because some cases were detected. In the south, 3 schools have now closed to sanitize and to make sure that everyone in their schools are tested and so forth. But this is very concerning to us. And I'll tell you, we have reached out to the Minister of Education to discuss this matter and to discuss the way forward, because the number of cases we're seeing arising out of the schools is of great concern to us.
How many children have tested positive?
I don't have a count on the children themselves, Marlene.
Okay.
I don't have a count, but I know that yesterday another child in the south was also tested positive.
Okay. Now let's talk about the schools that have been closed. You identified 3. There's the Santa Cruz Primary School.
Yeah, and the Independence High School, and I believe there's a Grace Primary School down there as well.
Okay.
I hope I hope I got that name correct.
Now, we've been talking about the increase of cases since the first cluster was detected at a casino in Belize City. Looking at it now, do we officially say that we're in a 3rd wave of COVID-19?
Not quite yet, because we have not seen what we call community spread. So far, we're seeing clusters, but we are seeing a trend. We're seeing a trend. We started off with the casino, where we had about 21 cases, and then we moved to the south, where we had an additional 21 cases. And I want to say also that we're looking at Orange Walk very closely, because we're seeing a spike there. One is related to a family situation, and the other one is in relation to one of the evangelical churches there. And so for us right now, the 2 hot spots are the Orange Walk district and the Stann Creek district.
So the cluster in Belize City, that time has passed, they've all recovered?
Well, they're all, if they have not recovered, they're on their way to recovery, but that has been contained.
Okay.
That has been definitely contained, and so that's a relief for us.
Yeah. Now, do we know the origin of these cases? In other words, where it was first introduced or how it was first introduced into these communities?
Well, I know that in the Stann Creek district, we have identified what the medical team calls index case, where it originated from. That person has been identified, Marlene, and that person is a staff member of the Santa Cruz school, no?
Now, what this does, of course, is, and I know you mentioned earlier that your next conversation is with the Minister of Education, but this was perhaps one of the first concerns from parents when there was the proposed reopening of schools. What does this mean now looking forward?
Marlene, obviously this has always been a concern for the Ministry of Health and Wellness. And obviously our call now, and has been for the last month, 2 months, is for our people to get vaccinated, particularly our teachers. I know there's a lot of resistance among the teachers to get vaccinated. However, the teachers have to realize that they have children in their care. And while the science shows that children, although they may not exhibit severe symptoms, children can also be carriers, and they can also contaminate parents when they go home, older parents and grandparents. And so it is a major concern, and it is very important for the teachers to get vaccinated. I don't know how it is possible for us to reopen fully our schools if our teachers are not vaccinated. And that is a conversation in which we're currently engaged with the Ministry of Education, Marlene.
What's the uptake for vaccination for teachers as of today?
The last numbers I saw was they were about 47%.
Okay.
Still very low, still very low.
Yeah.
You know, the Ministry of Education has given permission to over 200 schools to open.
Yeah.
And that does not take into account the additional numbers that will want to be opened when August comes around, between high school, primary school, sixth forms, and so on. And so there is a window of opportunity right now to make sure that all of our teachers get vaccinated, and I am appealing to them to do so.
Now, when we look at what's happening with COVID around the world, and other countries are moving into another wave or recovering from another wave, what we're seeing is that the new variants that have been detected are now affecting children. Has the Ministry of Health moved into planning as to how we're going to protect our children? Will they eventually be included in our vaccination rollout?
Yes. So in terms of variants, I can tell you that we have ongoing relationships with Baylor University, and we send to them frequently some of our swabs to test to ensure that we do not have any other variant in the country. And so far from the reports we've gotten, there are no other variants apart from what we saw in January. In terms of vaccination of young people, you will know, Marlene, that Pfizer is one of the vaccines that has been approved for children between 12 to 18 years old. And so we are actively looking to see how we can acquire some. Obviously, the next stage of vaccination has to be that age group.
What phase are we right now at the rollout?
We are at phase 3. We are planning to open up phase 4 shortly. And I expect in the next couple of weeks that's going to happen.
Now, Minister, when one looks at the update coming out with the vaccination rollout, it is very clear that there is a decline from when we first started. The early reports in March, there were about 2,000 vaccinations a day. In the past week, some days there were about 500 vaccinations a day. Vaccine hesitancy is something that all across the world is being challenged. How are we fighting that here?
Yeah, Marlene, we started in the thousands when we just began per day, which was great. I can tell you that we're averaging anywhere between 500 to 600 on average. Yesterday we had a pretty good day. We had over 870 people vaccinated yesterday. Now, what we're doing is we're teaming up with some of our businesses to provide incentives to people who get out and get vaccinated. We're also looking to see, Marlene, how we can ease up, how we can allow people who have been fully vaccinated some other measures of freedom, so to speak, that those who have not yet been vaccinated would not be allowed to enjoy. And so we're looking at these things carefully. We're looking at how we can bring over that message to our people, the importance of the vaccination. You know, I keep on saying, the medical team keeps on saying that the advantage of being vaccinated far, far outweighs any side effect that you may suffer. So again, we're teaming up with the business community to see how we can best get incentives out there.
When you talk about loosening restrictions for fully vaccinated persons, how would that work?
Well, Marlene, certainly we're looking at, first of all, how people will be able to prove that they have been fully vaccinated, because I think that is the first question. You know, we always want to work on a good faith system, and we're always going to have the fullest of trust in our people. But at the same time, I think we need to be foolproof. And the only way we can do that is by having some type of vaccination ID. And so that is also an ongoing discussion we're having to see how best we can come up with that.
Yeah. And what type of incentives are you at this point considering?
I believe that some of the businesses are going to be offering prizes. Some are going to be doing some money donations to people who go in and get vaccinated, and of that nature, Marlene.
Yeah. So let's shift back to addressing the hesitation that people feel. Part of it is the side effects, and part of it is that people just are fearful of taking this vaccination. It's part of the education that has to happen. What is currently taking place to help to encourage, especially the high-risk populations, to get their vaccination?
You know, I can tell you, Marlene, that the age group 60 and above, which is among the most vulnerable, have rarely come out and gotten vaccinated. So I believe we have about 75% of that group. And that was one of the priority groups for us. But that being said, Marlene, the Ministry of Health and Wellness has embarked on a major education campaign, getting the facts out there about the vaccine, about the side effects of the vaccine, and about the benefits of the vaccine. Obviously, I think we need to do much more. And some of the strategies we are employing is actually going into the rural areas, have our health educators go out there, talk to them about the vaccine, and then come back into the villages a few days later after the education has taken place to offer the vaccines. And so that is going to be rolled out very shortly.
What seems to be the most convincing factor for the rest of the viewers who are watching right now who are still unsure?
The benefit of the vaccine absolutely saved lives, Marlene. I can tell you that for example, with the princess outbreak that we saw, the people who were vaccinated were asymptomatic. They had no kind of symptoms. And so I think what bears out is that the vaccine works. We have been saying the vaccine will not prevent you from getting the COVID, but what it will do is, one, it will, the side effects you're going to have if you contract COVID are not going to be severe. And we've seen that. And also the vaccine saves lives. It guarantees that you're not going to be dying from COVID. And I think that those benefits are incredible.
There's a very important lesson that came out of that particular outbreak, which was that if you've had your first dose, it kind of gives you a little bit of confidence, feeling like you're safer. But that's not necessarily the case. What's it been like so far in terms of people coming back for their second dose?
Well, it has been great so far, Marlene. Just to share some numbers with you, up to yesterday, we had 68,700 people with first doses. And of that number, 12,630 have received second doses. So the people who have been getting second doses, initially when we started, they were being given an 8-week window to come back. And then we went into the 12-week once the guidance changed. And so we're right up to where we need to be in terms of people getting second doses.
So currently we're giving out two vaccines. We're giving out the Sinopharm, the Chinese vaccine, and also
the Sinopharm, yes.
Sinopharm, thank you.
Yes.
And also the AstraZeneca. Yesterday, we interviewed the Prime Minister. He indicated that there is an agreement to acquire the Johnson & Johnson vaccine. I think he said as many as 200,000. Can you give us an update on that?
Right. So we are working through the African platform, which we were dealing with through CARICOM to acquire the Johnson & Johnson vaccinations. We have made a down payment for 115,000 doses. We are expecting those to be in country, Marlene, by August of this year.
Okay. And we're paying for it, or it's a donation?
No, we are paying for it. We are paying for those.
Mm-hmm.
You know, we continue at the ministry, we continue to look for other vaccines, especially the ones that have received emergency use authorization from the World Health Organization. Yeah. That's our standard. And so as the World Health Organization recognizes more vaccines, we actively try to see how we can acquire them for our citizens.
At what point we were also supposed to get the Russian vaccine, the Sputnik 5?
We were supposed to get that. However, that has not borne out, Marlene, and those discussions are also ongoing, but we do not yet have a date for the delivery of the Sputnik.
Okay. Another key component is, of course, looking at acquiring the Pfizer and Moderna vaccines, and these require specific equipment, yes, thank you, to allow for the storage. It's called cold storage or ultra cold storage. So right. What is the update in being able to ensure that we have the equipment necessary so if we get access to these vaccines, we can take advantage of it?
We are expecting to receive some in country, I believe, sometime around the 17th or 18th of this month, if I'm not mistaken. I hope I have those dates correct, but I can tell you that the month of June, we're expecting some of those freezers. And again, it is in line with the discussions we've been having to acquire the Pfizer vaccine and to target that 12 to 18-year-old population, Marlene.
Yeah. Now, as we await whether it is the Johnson & Johnson vaccine, as we try to encourage more people to get vaccinated, we just have to look at our partners at the region around us. Mexico, Guatemala, Jamaica, Trinidad, where they are battling an outbreak. How concerned are you that we may actually see a third wave that takes us back to what we saw earlier this year?
Of course, we are concerned. We keep monitoring what's happening in the neighboring countries, Marlene. And the best that we can do is, one, to make sure that our facilities are prepared to deal with it in the event it happens. Mm-hmm. Two, to continuously educate our people to try to have the message of the fact that this vaccine is spread through human interaction, for that message to sink in, to continue to encourage them to adhere to the public health measures, and trying to do the best we can in terms of those factors. I keep on saying that unless the people understand and unless our people cooperate with us and are willing to abide by the public health measures that have been implemented, this is going to be a difficult battle. Yeah.
What's our current positivity rate?
The current positivity rate, if you allow me 1 second, it is 2.23.
Okay.
And so we're still below that 5% mark. That is the world standard, no?
Yeah.
We're still below that.
Yeah. But it's moving up. At one point it was 1% or a little less.
It certainly is moving up, and it has been fluctuating back and forth depending if we're seeing spikes or not. Yes.
Mm-hmm. Now, what's the plan for containment for these clusters that you've identified?
Well, they are in isolation, Marlene, and they're being monitored closely by the teams on the ground. Mm-hmm. And that has been one of the strategies that has worked tremendously for us. We've been able to quarantine the people who we have identified as being positive, and that has been successful for us.
Yeah. Minister Shabat, as you're aware, the medical community has voiced their objections in regards to the reopening of the borders for foreign visitors, specifically citing how Quintana Roo and Petén are in what those countries classify as red zones. They have an active outbreak. From your perspective, we've spoken with the Ministry of Tourism already about the protocols they have in place and border management. But from your perspective, how do you further this discussion with the medical community, being that some of the outspoken members are actually a part of your advisory body?
Yes, Marlene. This has been a challenge for us. Obviously, we convened that team for them to advise us on the best way forward. And when they speak, we listen to them very seriously, and we take very seriously what they say and the advice they give us. In this case, Marlene, I can tell you that we work very closely with the Ministry of Tourism and the Ministry of Immigration to make sure that we have as much safeguards in place as possible. And there is a balance that has to be struck. You know that for us, it has been equally important to reopen the economy. We have too many people unemployed in Belize. When the surveys were done and the projections were done, we did not feel that we would not be experiencing a flood of people coming in through our land borders. And so far, that projection has worked out. It has been a trickle. I can tell you that recently we modified the SI in relation to people coming into the country, and we required that they must present a vaccination card to prove that they're fully vaccinated and that they last received their second dose 2 weeks before arriving into the country. Mm-hmm. If you can't prove that, Marlene, then you are bound to do a test here in Belize before you're allowed to enter into the country. Another thing that we changed is we are now requiring anybody entering the country as a tourist to have a minimum stay of 3 days in the country. And what we're trying to do by that is to ensure that we don't have people just passing through the country, going from one point to the other point. Yeah. And we felt that those are important safeguards for us to be able to control anything that might arise from the land borders. And so far, Marlene, I think it is bearing out.
Yeah. Has the ministry explored other options, as we've seen in the region, like only allowing vaccinated travelers to enter the country?
Well, that is part of the discussion, Marlene. And as you know, our largest market continues to be the North American market. Mm-hmm. And our neighbors in the North seem to have been very successful in vaccinating quite a significant portion of their populations. And so what we're currently seeing, both at the airport, also at the airport, is we see tourists coming in who are fully vaccinated.
Yeah. Now, this I think one of the things that you've said and the Prime Minister reiterated yesterday was that you have a commitment to follow the science and to listen to medical professionals. If we are to go on experience, when there were concerns about reopening of the casinos, concerns about reopening the schools, we are seeing exactly what people were concerned about. There was an outbreak in types of institutions. How do you learn from these lessons moving forward when the medical community says this is not a safe venture for our country?
Yes, Marlene, we always try to follow the science as best as we can, but I think the considerations for the cabinet and for the government is a bigger perspective, and while we are very much concerned about the health of our people, we're also very much concerned with the economic situation in which we find our country. And so for us, when we sit as a cabinet, it is important for us to try to find a balance, that we can protect as best as we can the health of our people. At the same time, we start to reopen slowly by phases the different sectors of the economy, because I think the reality is, Marlene, that our people need to get back to work, our people need to eat, they need to pay their bills, they need to send their children to school. And so what we try to do at the Ministry of Health and Wellness is to try to implement as many measures as we can to make sure that when the government decides to reopen any of the sectors of our economy, that we have sufficient safeguards in there to try to narrow and to lessen any of the side effects that we may see. And I can tell you, I want to say this very clearly, at this point in time that the clusters that we have experienced have been controlled. And that is because of the work of the people of the Ministry of Health and Wellness, our doctors and nurses, our public health inspectors, our surveillance team. We cannot be I cannot say how grateful we are to them for the work that they continuously do, and the successes we've seen in this country is because of them.
Yeah. Now, as you talk about this this cross-ministry effort that has to take place, whether it's Ministry of Immigration, Ministry of Tourism, definitely Ministry of the Home Affairs. So when we look at what is currently happening in the country, there are repeated reports of mass gatherings that are taking place, whether it is for a social function, sometimes it's funerals, sometimes it's multiple types of events that people may be having. What's the discussion taking place there? Even things like the vigilance at the border crossings, where we know people move without passing through any kind of immigration.
So again, Marlene, we constantly speak to the Minister of Home Affairs and to the Commissioner of Police. At the Ministry of Health and Wellness, we set up the protocols, we set up the regulations that we feel, our team feels is the best to implement. And then we leave the enforcement to the police. Obviously, I do agree that we have seen a lot of a slackening up of the enforcement of the measures, and I think people are to a large extent exhausted of being home on curfew, of not being to go out and socialize and gather and so forth. However, we cannot forget that this virus is real. This virus continues to be among us, and so we are continuously engaging the police. Over the weekend, I got videos of some places in the Orange Walk district that some clubs are having parties disguised as restaurants. And these things are very worrisome to us. We continuously send these things to the Commissioner of Police, and we ask that these things, that the rules, the public health regulations be strictly enforced. As you know, Marlene, we moved away from a system where people were being summoned to come to court to a ticketing system. And so we are pushing the police to go back to the strict enforcement of these protocols.
Meaning that they take them into the to a holding cell?
No. That they make sure that these places that are supposed to be restaurants operate as restaurants with the capacity that has been designated by the Ministry of Health and Wellness, and not just disguised as a restaurant and then turns into a nightclub. To make sure that we don't have more than the allowed amount of gatherings, whether it's at funerals, weddings, or other parties, to enforce the regulations, Marlene, because as you correctly see, we have seen a wanton disregard for them recently. No?
Yeah. Is there a phased approach? I keep on talking about what we see just right around us once again. When Mexico has the stoplight system, Guatemala has a similar one for each state. This amount of capacity in the hospital or hospitalizations, we move from green to yellow or orange, and then orange to red. And all of these have actions that the public can anticipate what will come. Are we at that point yet that if we see the hospitals, more hospitalizations increase, that there is a predictable pattern as to what will come next with regulations?
Right, Marlene. So we're trying to be guided by the standards set by the World Health Organization, and so our benchmark is really that 5% positivity. If we see that we're back up to the 5% positivity daily rate, and it is consistent over a period of time, then we will have to move back to some drastic measures. We are praying that does not happen. But that 5% is really our benchmark.
Mm-hmm. Now, what's been the status update in checking in on COVID units across the country? We have seen where things have escalated to the point where people died in parking lots because the hospitals were so overwhelmed. Have we been preemptive, understanding that there's an increase in cases, that we do a check of the hospital systems to ensure that we don't encounter that type of situation again?
We're continuously doing that, Marlene, and I can tell you that that particular circumstance, which I think occurred at our National Referral Hospital, I can assure you that that will not be happening in the future. They have actually an incredible surge plan in place, and a lot of infrastructural work has been done at that particular institution. We have, through the Ministry of Health and Wellness, we have provided them with millions of dollars in equipment. And so that in the event that we have a third wave, I am confident that our National Referral Hospital will be able to deal with it. I mean, provided that we don't have incredible numbers, I must warn that, as we all know, while we may have equipment, we don't have for large numbers. I think the bed capacity at the National Referral Hospital is maybe about 52 beds. And so while we have capacity, our capacity is very limited. And that goes throughout the country. We keep working with our Western Regional Hospital to make sure that their surge area is also 100% ready to go. As you know, Marlene, we made some recent adjustments to the oxygen infrastructure and the electrical infrastructure at our National Referral Hospital. And this is all to make sure that in the event we do have what we are dreading, which is a third wave, that we are prepared to deal with it.
Yeah. And things like securing sufficient oxygen, which we saw as a major issue in the Indian outbreak.
Well, oxygen is always a challenge. Oxygen is always a challenge. And here in Belize, you may know that has been the major component in treating people who have to be hospitalized because of COVID. And so oxygen will always be one of the areas that we're going to be looking at critically. For now, that need has abated, and hopefully it will remain that way. Yes.
Now, there is another issue in looking at, while you may have beds and you may have units, it's also a human resource issue. Minister, I'm sure you know that the nursing shortage is of extreme concern for the medical community in Belize. More so now because I believe it was last year there was an increase in the cost of work permits. And so quite a number of our foreign nurses that we have working in country are choosing to find opportunities in other countries, lessening the amount of nurses that we have working at this time. I do note that, as you had committed, there is a scholarship program opened for 50 new nurses to go to school, or 50 new students to go to school to become nurses. But in the meantime, we are going to be short in a time of already a shortage.
Yes, Marlene, that is of concern for us. And I can tell you that as a government and in communication with the Minister of Immigration, we are looking at the cost of the work permit for nurses, and some overtures have been made in that direction. But the shortage and the potential increase in shortage is of concern for us, and it is something that we continuously address. We get some nurses through the Cuban Brigade. We're looking at Nicaragua to see if we can get some from there. We usually get some nurses out of Nigeria, and the largest amount of nurses come from the Philippines. And so we continue to look around to make sure that we don't have the significant shortfall that could arise because of that whole work permit issue, Yeah.
So you're looking at exceptions for the work permit fee for maybe nurses?
I wouldn't say exception, but we're looking at somehow to reduce it to make it more accessible for them.
Yeah. Have you gotten an update as to how many nurses have left or intend on leaving?
I believe that we are going to be having about 25 to 30 nurses leaving from, particularly, I believe, from the Carl Huchner Hospital.
And what is the plan to be able to fill those slots?
We are looking at our, like I said, we're looking at Nicaragua. We're in conversations with Cuba and the recruiting agency in the Philippines. So we're looking at all of these places to see where we can recruit nurses from.
It's a tough spot. I mean, we are competing with the UK, US, Canada for benefit packages.
And that has always been our challenge. I think even for many of our Belizean nurses, they find it more lucrative to go to these countries. And so that is a continuous challenge. That is not something that is new or is particular to now, Marlene. This is something we have been experiencing for years and years and years. And so the challenge for us here in Belize is one, to see how we can educate more of our people to become nurses, and two, to find the ways that we can compensate them to make it so that after they've completed their studies, that it is attractive for them to remain in service in Belize.
Okay. Now we have a question coming in from the viewer from one of our Facebook streams, and I want to get that into you if you'll allow me. Jake Martinez wants to know, can we get our vaccines before the due date?
So the requirement is, the learning is that you can get your vaccine anywhere between 8 to 12 weeks after you have gotten the first one. You're being encouraged to get it closer to the 12th week. It is believed from the science that we have and from the guidance we have that is when your immune system is highest, or that is when your body is able to produce much more immunity to the vaccination. I hope I'm getting those terms correct, because those are really medical terms and ideas, Marlene, but that is the science.
So if for example, I've been given a 12-week wait, I can do it between the 8 and 12 if it's better for me at this time.
Correct.
Okay. And do people have to use the online application system, or can they just show up at one of the clinics and get their vaccination?
Well, we encourage them to do the online because, as you know, Marlene, we try not to waste a vial, and so we monitor it very, very closely. Once a vial is open, we want to make sure that we have a minimum of 10 persons to be vaccinated. And so if you log on to the app and you make an appointment, it helps our healthcare people to organize themselves and to plan. And so we encourage everybody to use the application to make an appointment to get the vaccine.
Yeah. Now, looking at what you are currently seeing with vaccination rollouts, I think you said on average it's between 500 to 800 a day. Why not just open it up? Let those who are interested in getting the vaccine of adult age get the vaccination, and then we move closer towards herd immunity.
Yes, Marlene, we'd love to do that. However, our supplies of vaccines, as you know, we're getting them. What we're getting in Belize right now is through the COVAX facility, and so we have to plan in accordance to when we are going to get our shipments. We don't want to throw the doors open and invite everybody to come in, and then you have people knocking at the door and we don't have vaccines available. And so we've done it planned in a phased way to make sure that we have vaccines to cover the targeted population at the moment.
One of the fears that people have is about the side effects of vaccinations. I know there's an ongoing monitoring system. What type of side effects have you seen, and how often?
Yeah, a lot of persons report headaches, severe headaches. People are referring some level of fever that lasts anywhere from a few hours to a day. People talk about having chills and so on. But those are the major side effects that we're seeing, lasting anywhere from a couple hours to 24 hours, Marlene. We have not seen on a large scale anything major beyond those. Mm-hmm. Some people have, they get very, very thirsty or very sleepy, but we have not seen any major side effects as a consequence of being vaccinated.
Okay. Now, bringing it back to our current situation with the cluster in the south, and you said that there's the detection of a cluster in the north. The contact tracing, I believe, is ongoing. Do
Absolutely.
you imagine that we are going to see more clusters within the next few days based on these large groups of persons who tested positive?
I think we may see an increase in numbers associated with those clusters. It is very likely, Marlene. I can tell you that we have teams both in the south and in the north doing surveillance and contact tracing and testing. And so it is very likely that we are going to see some additional numbers arising out of both areas.
Will you be asking in Orange Walk, when we saw the last outbreak, we know that a lot of it was tied to interactions across the border. Are you also asking for more vigilance in that area?
Absolutely. Marlene, again, that is especially in the South, believe it or not, that is one of the things we're very much concerned about, because as you know, our borders are very porous, and as much as we try to control them, it is virtually impossible to absolutely control them. And so again, we're depending on our people to be smart, to act wisely, to act in what is their best interest and in the interest of their loved ones and of this country. Because for every person who gets infected, you have the potential of infecting 7 other persons and so on. And so again, it goes back to an appeal to our people to act wisely and to act in the best interest of their health and the health of their loved ones.
And before we close, let's just look at the vaccination rollout and the percentage of the vulnerable populations. I know you usually have these numbers. You said teachers are at about 47%. Where are we with other frontliners and other vulnerable groups?
Unfortunately, I don't believe I have those numbers this morning. I need to get an update on them. My apologies, Marlene. I'm not on those numbers, but I promise I'm going to get them and I'm going to send them on to you. Maybe you can share them in your evening news. I apologize about that.
Okay. Well, any final words to our viewers this morning?
Yes, Marlene. First of all, again, thank you, and thank you for the opportunity. And again, my gratitude goes out to all of our frontline workers. The work that you all are doing is just incredible, and we are indebted to you. And again, I am appealing to our population, especially our teachers and our immigration workers who are at the front line, to please get out and get vaccinated. The vaccination saves lives. Please get vaccinated.
All right. Thank you very much. And you've gotten your second shot already?
I did get my second shot last week. And I'm here, so I am living proof that the vaccination will not kill you.
All right, and that means you are far more protected now. Thank you so much for joining us and for providing this update, and of course, continue to stay safe.
Thank you very much. All the best to you all. Thank you so much.
And there you had it. That was the update on the COVID-19 situation in Belize from the Minister of Health and Wellness, Michelle Shabat. Clearly, there are a growing number of cases in the country at this time. Contact tracing is still ongoing, but we do encourage you. It doesn't matter if the cluster is in your specific community or region, that we continue to follow all the protocols that are asked of us, wash our hands, watch our distance, and wear our masks. We're going to go ahead and take a break. And when we